Hi everybody, I'm Laurie Cadden, and we're here today because this is the first series of a 12-segment series on the Lackawanna County Medical Society's Public Health Education Series. We are going to inundate you all with wonderful information so that you can be the best, I'm going to say the best known, you can have the best information, you can have a conversation with anybody about health because we're going to help you do that. Today is the first one, as I said, just so we know. It is funded in part by Commonwealth Health through ECTV, and we're looking forward to this series. It's going to be very informational, and we hope we'll keep you engaged. I know we will, especially with my first two guests because they're wonderful. We have joining us today Dr. Ariane, I like to say it that way, Ariane, how about that? I'm going to say it differently anyway, Ariane Conaboy. She has a private practice in internal medicine, but she is working through Commonwealth Health. She is here to give a little bit of information from the medical standpoint, from a physician side. And then we have Mr. Kris Novak, read this exactly, Coordinator of Student Health Services at the Wright Center. So listen, we're going to tell you a lot of information. The first topic we have, which I know it's a newly coined term, but I looked it up just to make sure I had it. It's called health literacy. Health literacy, which I think is so important, and when you hear a little bit about what they're going to tell you, you'll understand why, but here's the definition. It's the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health choices. This is crucial nowadays, as both of you can attest to, with the growing population that we have, all of the ethnicities coming into our area, and just in general, making people fully aware of their health. I always say so many times before, and I think it's changing, and I like to say, I know myself when I go to a doctor, you remember the old days when you would sit there and you'd be afraid because you would just listen to everything they said and take it and you had to do it. Now there's much more of an interaction. It's much more back and forth if you're doing it the right way, I think. Because, Ariane, as a physician, yes, you know the end of it because that's what you're trained to do. But the person sitting on the other side has rights too. They have a right to question, they have a right to ask why you want this, and they need to know so that when you're telling them what they need to do or the help they need, they can say, okay, why do I need this? That becomes where they become literate in their health, and then they're able to function better and to get the right tests and the necessary information to make them a healthier person. So in light of all that, tell me from your standpoint, do you see this often? Do you see it changing? Is it getting more important and more apparent that we need information on this? How do you see this from a health standpoint?
Absolutely. I think that it's really, really evolved, at least over the last 10 to 15 years. I remember being young, going to doctor's appointments with my grandmother when I was home from school, when everybody else was at work. And sometimes I would be in the car with her driving home, and she would say to me, you know, what do you think about that? And I would say, well, do you feel comfortable with that? She'd say, well, so Dr. So-and-so told me what to do.
Yeah.
So I'm not going to question him, you know, and I would say, oh, okay. But now I see things being so different. I see a lot of patients questioning us and really, really getting involved in their care, and I think it's wonderful. We see patients come with lists. I know we were talking just before we started, and Kris had said, you know, a lot of patients will come with agendas, and I think that that's wonderful. I think that just as important as state-of-the-art healthcare, we really need to have patients feel empowered and feel comfortable with their decisions and know exactly why we need to either obtain further testing or start a medication or do anything. We want them to feel confident with us, and we want them to feel like they're their biggest health advocate.
And in truth, too, I'm going to just say Dr. Conaboy, it's respectful, and that's what it's going to be. When someone says, you as a physician say, I think you should have this test, or I think you should have that, you have a right as a patient to say, I'm not going to do that, I will do that. You need to stand up for yourself on the other side of that, whether it's the desk or the examining table or wherever you are. You need to be able to have the power within yourself to say that, because like you just said, and I know it's true with my grandma, God bless her, she's gone now with 8 years, but the fact that, 7 years, but the fact that she used to feel the same way, or anyone else, I was told I have to do that. You don't, yes, you're told, and yes, you're offering the best advice, but you have to be able to make a difference. And Kris, you see this working in the Wright Center, you see people coming in and people who need services. How do you see it? From the medical standpoint, one, how are you viewing the changing population and what people, if they do they need more? Do you feel it's getting stronger? What do you see?
Well, the whole point is a sensitivity to different demographics with health literacy. For example, people have language barriers in this area more than ever. The elderly population, we need to be sensitive that they may not understand anymore some of the procedures. Therefore, there are different techniques such as a screening tool called the REALM. It was developed by the Agency for Healthcare Research and Quality.
And is that an acronym?
Yes.
Okay.
Yes. It stands for the Rapid Estimate of Adult Literacy in Medicine.
Okay.
Nailed it.
Yay!
But yeah, it's a screening tool. So anytime a first-time patient comes in, or any patient for that matter, it's a list of 7 commonly used medical terms such as behavioral, bacteria, asthma, anemia, jaundice, and we actually ask the patient to say these aloud and to enunciate. And how well and how confident they enunciate these words, we can actually estimate their literacy level.
Okay.
So, for example, if somebody has a 2nd grade literacy level, which does happen, and a doctor comes in, he's not going to say, you have hypertension. He's going to say you have high blood pressure. Okay. And that subtle substitution is so very important to understanding their chronic conditions. And
can you see it in their body language when, or does it ever happen when they do use, say, hypertension instead of high blood pressure, and then when they say, or high blood pressure, do you see the reaction in them knowing then the difference?
They would actually become more conversational.
Correct, okay.
Exactly, and it's great to see that. And if they hear words they don't understand, they're more likely to be silent during the entire visit.
And you said that the 3 biggest problems are the age, language, and education level of a patient or someone coming in who needs this. All of those 3. How do you know that? Is it just, did you do the research? Is it part of this whole study that's being done? How do we know that's it?
There's national studies, and actually 1/3 of the population has a low literacy level. So this is a very important issue, and it's a prevalent issue that we have in the area.
And do we see any changes? How do you guys, both, either one can answer, how do you see things changing? What are we doing as a community to make people, or give them the opportunity to become much more literate in their health? What are we doing? Do you know?
Sure. If you were to, for example, if you were to take literature 10 years ago from doctors' offices, whether they were health brochures explaining vaccinations, explaining different types of chronic conditions, if you took that literature from 10 years ago and compared it today, it's vastly different. And it's different that it is written at a 4th grade level these days. Back then, it might have included much more complex terminology.
Yeah, that the lay person doesn't necessarily get.
Absolutely.
So why do we think that's the case? Has it just been proven that, Doctor, you might be able to answer this. How does, or Kris, I don't care, I'm just throwing it out there because it's important. I think people should understand that. Why was what was the shift? What was the purpose of the shift?
Well, health literacy, it causes 2 problems. One, the patient are going to have worse outcomes. They're not going to get healthier if they don't self-manage correctly and they don't follow proper medication protocols. And secondly, because they're not self-managing, they're being seen over and over and over again for the same problems. And that causes a strain on health resources. So that this became known, and it takes a collective effort to fix this. And once literacy levels, once we understand how to approach it correctly, which we are, and we're improving every single day in health literacy. And once we do, we'll actually see health costs, or the health costs go down.
So, doctor, do you believe, who do you, we know from a standpoint of doing the testing and all of the surveying and knowing how, you know, the certain demographic, but when you see it, do you see those same three categories, or do you see a difference? And how do you think people are becoming, how are they helped when they come in to see you? Is there someone with them? Do you feel you have to duplicate your information because they have to come another time? How does that work?
Often they do have either a friend or a family member with them, and a lot of times in my office, sometimes I feel that people are more health literate than they might actually be. What I mean by that statement is that I see a lot of my patients being very internet savvy. And I think that there's definitely wonderful positive aspects to that, but depending on their sources, if they are not as credible and more alarming, sometimes that could have a negative aspect to the patient's either perception of their health or how they're doing. So sometimes if they have a specific complaint, let's say if they have abdominal pain or pain in their belly, and they'll tell me, well, I think that I have cholecystitis. I think that it's my gallbladder because I think that I have gallstones and I get pain after I eat and this bothers me. And then I'll start to talk to them about cholecystitis or gallstones in the gallbladder. And then the discussion will become a little bit more technical because they're using that term at first. But maybe I don't realize that they found that term on Google, and the other health terms they might not be as familiar with because it might not have been in the paragraph that they had read. So I think that it's always important for us as healthcare providers to realize that we want to stay on that common level. And what I tell patients when I use terms that are more advanced, that, hey, in addition to college, I spent 4 years in medical school and residency to try to really, really attain a good grasp on these terms, and that I would never expect somebody who didn't have that training or that studying or pay that money to really, really, really grasp those at that level. I think that it's really, really important for patients, though, to understand what we're saying. And if they don't understand, just like my grandmother didn't, stop the doctor and ask the doctor what he meant and exactly why did he definitely want her to go for that test, or why did he want her to do that. I think that it's important for patients to feel comfortable, and through that comfort and through that knowledge and self-awareness, I think that they really, really will have decreased visits, and they'll feel more confident, and they'll manage themselves more appropriately, just like Kris was saying.
Do you see that some of the older doctors who are used to doing things the way we were talking about our grandmas being there, and do you find them adjusting nicely to this, or is it a little bit harder because younger people, they want the engagement, they know it's much more, people are a little more savvy necessarily because they can go on WebMD if they can, or those kind of things. And some of these people, they may not have the availability of the internet, but people do know it and they self-diagnose and they do. So sometimes what they do know might be a little confusing, right? From a literacy standpoint of health, they might think they know more than they actually do because of the access, the availability of terms. Do you find that at all or not?
Yes, you would answer that.
I personally do. I find patients getting decent information from their sources, but sometimes they'll ask for specific tests that may not be necessary.
Right.
In other words, in that patient who I mentioned, if she thought that she had cholecystitis or gallstones, she'll say, I think that I need this HIDA scan because I want to find out my gallbladder ejection fraction and its functioning. And I want this scan because I want to find out if I have stones in the common bile duct. And then I'll say, well, we did your ultrasound, and the ultrasound did show that there was no stones.
Right.
So you really don't have stones in the duct, and your gallbladder is functioning appropriately. So sometimes you do have to backpedal a little bit. But that being said, I think that that's wonderful because patients are empowered and they are working with you as partners in health, which is what you want, which is you You definitely want to have that discussion, and you definitely want to keep the door open. And you definitely don't want to dismiss any requests without explaining why and having the patient feel comfortable with your explanation.
Tell me also, because Kris, you alluded to this earlier about asking certain terms and if they know this. How do you then, doctor, be able to assess where they are from a health literacy standpoint? Do you sort of do the same thing, or just upon a regular question and answer, you're gonna automatically know it?
Typically in my office, we actually don't use that questionnaire. I think that that's a great tool.
Mm-hmm.
However, a lot of times I like to bring the patient and I like to ask them how they're feeling, mentally and physically. And if they have a certain condition, or I'm not quite getting where they are with regard to their literacy, sometimes I'll say, what's your understanding of this? And then I'll have them describe for me in their own terms where they are, what they're taking, if they're taking any medications, if they've had any therapies, if they've seen any specialists. So they'll describe in their own words how they feel that they're doing and what they've been doing in the last few months since I've seen them. And I find that that's really, really useful and powerful, because everyone's perceptions are so different. I have patients who have back pain and they're very, very stiff, and it's very difficult for them to walk, do different things. And then I have patients who have back pain, and it might hurt if they bend a certain way. But that patient, it's very difficult for them to walk. They might perceive themselves as doing pretty well for their age. Whereas you could see another patient who's exactly the same age and who has back pain maybe once or twice a day when they bend a certain way, and they'll say, boy, this really affects my life. So I think it really varies from a patient to patient basis, and everyone's perception is so different.
So then, do you also believe that obviously any of these preventative type screenings like a mammogram or any of these, whether it's high blood pressure checks or any preventative testing, how does that fall into the health literacy? Just because having it done, you're going to talk to them about it and it's going to increase their knowledge? How does that fit in?
Based on their age, based on their risk factors and their medical history, we do like to discuss recommendations by the American Medical Association or something called the U.S. Preventative Service Task Forces, who do make routine guideline recommendations. I like to discuss with patients, for example, women over 40, about getting a mammogram, about saying that yes, maybe in 10% of cases, God forbid, we may not see a breast cancer, but in 90% of cases, we would see something on the mammogram. And what's really appealing to me is that, hey, if we find something, God forbid, and it's small, a lot of times you can have a lumpectomy and you won't have to have complicated further surgeries or even radiation if something is found early. So we do recommend routine screenings. We do recommend routine screenings for colon cancer in the general population, 50 and over, to find polyps that over time, sometimes over a 3 to 4 year period, can become precancerous. So I like to discuss these with our patients, and then based on their own personal history, their family history, and their own personal beliefs, they can really be empowered to make that decision to try to see if they feel that would be appropriate for them.
And so I think too with all of this, because it all sort of makes a little more sense to me, talking about the three which we said were age, language, and education, the testing and the making sure that the patient understands their body and what's happening to it. I think that it seems to me that regardless of the other three, although that's a big problem, just being your own self-advocate, your own, knowing what you need to do, knowing the test you need to have, that's going to make you a better person about your own health, no matter where you go or what you have to do, whether it's another doctor or not. You have control a little bit more information and control over your own life. I mean, I'm sure that makes, when we say health literacy, that means to everybody, whether it's any of these three or anyone else. We know that the population in our area, we have one of the largest senior citizen population. We have all of the influx of the different ethnicities coming in. All of these things will hinder that. But if none of those are true, and say you're, like you were saying, Doctor, you're a 40-year-old woman, you're going to say, I think you need a mammogram, I think you need this, we need to do. That's just going to increase your awareness and be a better person of health going forward as you age, as you go through all these changes. It's just going to be better for you all the way around to always be a self-advocate, to be the one who knows your body best.
We do say that, and I do honestly believe that. I always tell my patients that they're their own best advocate, and nobody quite knows exactly how you're feeling or how it feels to be your skin than you.
Yeah.
So it's definitely good to speak up, ask questions, find out what blood tests somebody's going to take if they're taking your blood, find out what they're going to do with this or what they're going to do with that, just because you're your own best advocate, and nobody takes care of you better than you.
You got it. Now, also, I want to ask you, Kris, what do you think? How do you think the area, our region, is addressing this? What do you feel we're doing right in this town that enables us to be better, to teach and to get people to understand what's best about themselves from a health standpoint, from knowing what's right?
From what I've seen in the area, especially in primary care and internal medicine, it's just the awareness that not everyone is on, we're just in a different time now. How you spoke about how your grandmothers would go to a doctor's office and kind of keep quiet. But it's a different time now, and we are sensitive to low health literacy levels now. We're changing all the literature in all of our offices at a lower reading level. We're including graphs, diagrams, easy to understand charts in our offices for people that honestly can't read too well. They can relate visually. It's the interaction between the doctor and the patient that's going to change, and it has been changing for the better.
And do you feel that people are grasping this? How do you feel people in general, knowing that all this is there, knowing that all of these changes are being made, how do you feel they're getting? Do you feel that it's increasing? Do you think it's making an impact?
Having conversations with our physicians, it's great to hear that the conversations in the exam room are so conversational rather than one-sided, and that's just extremely important, and it's completely different, like I said, from if you were to even go 10 years ago. The conversation in the exam room is much different today than it was.
And I think I say these on any of these health shows that we've done throughout the years. It's so important to understand that doctors are just people too. They're human, just like you and I. And when you go to them, they're there to provide a service and to make you feel better and to do what they need to do as the doctor and you as the patient. But you can talk, you can ask these questions, as you're saying, Kris. The conversation needs to be flowing on each side, not just coming across like you will do this. Why? Ask questions, get the information you need, because that's only going to make you a better person and a better person to sit there and have the conversation with the physician. I mean, that's just got to be better all the way around. And from your standpoint, Dr. Conaboy, as Kris is saying, he sees change. Do you see that the impact is being made? Do you see a difference?
I definitely do, and I think it's very, very positive. I think as a physician at this point, we want patients to feel comfortable with us. Sometimes I'll share even my own concerns, or I know personally I'm working now on trying to find more time for exercise, and that's one thing that's been bothering me. And I know,
as everybody else, right?
It's hard for patients too.
You
sometimes.
can relate then.
Especially if you're working, you have children, you have parents you're taking care of, you have different obligations, and sometimes it can be difficult to find the time and make the time. But I think that it's just important to share with patients as a provider, or to discuss that we're all really, really in this together, trying to be the best people, the best patients, and the healthiest that we can be. And hopefully, as we attain higher levels of health literacy, as we perform screenings, we really will be a healthier population here in northeastern Pennsylvania.
And what do you think some goals could be put forth to help someone, whether they're coming to deal with someone at the Wright Center or they're dealing with a doctor? What could people take away from this that you could say, here's what you should do to have a better encounter with the physician the next time you come in? What, if both of you could answer that, that would be great. Kris, from your standpoint, what do you think?
Absolutely. The number one thing a patient can do to immediately increase their health literacy is to bring an agenda to their next exam.
Okay.
Write down questions that you have about your medications, your medication plan, any problems that you have aside from why you're visiting the doctor. Have an agenda. Facilitate the conversation. Like you said, you do have a voice when you're in the exam room, and the doctors want to have that conversation with you. So my number one change to immediately see an increase in health literacy for the patient is to bring your questions with you.
There you go. And what do you think? The same thing, or can you add something from a medical standpoint?
Oh, I mean, absolutely. I think the agenda is a fabulous, fabulous tool. We see patients bring them, and they really, really do help the visit move smoothly, and also for the patient to address everything that he or she wants to address. I know many times I've been in the patient's chair thinking, as my doctor is walking out the door, oh, I forgot to ask that,
Yeah.
And boy, if you had that agenda there, you'd be all set. What I would also want to add would be that the patient needs to be comfortable. I want my patients to stay with me as their provider, but I want my patient to be comfortable with me or whoever they see. I want them to know that we are accessible, that if they're not feeling well, if they have a question or concern, that I want them to know that they can call our office. And also to know that if they're not feeling well and they don't have a life-threatening emergency, that they should be offered an appointment within that week or that day or first thing the next morning, because we care about them and we want them to feel comfortable with their care.
And I think that's great, and I want to give both of you anything else you want to say that I didn't ask that you think is important for people to understand? After all, it's an educational series, so we're hoping we can do that. Is there anything else you think we didn't cover, Kris, that you may want to mention before we close?
No, I think we covered it. I covered it very well, and we give people an idea of how to instantly increase their health literacy.
Yeah, and what do you think, Doctor?
I definitely agree with Kris. I would want to say that I wouldn't want anybody, regardless of their age or education level, to feel uncomfortable or to feel uneducated about asking any question. A lot of times, I think that sitting in the provider chair, you may think that patients may understand something that they may not. But I think it's important to stop the doctor or whatever provider you're seeing, and just make sure that you understand everything clearly. So just ask questions.
There you go. Perfect. And you can't blame someone. You have to keep question. That's what works. So I want to thank you very much, guys. You did a great job.
No,
Thank you.
We're
Thank you for
happy to
having us.
keep going with these. As I said, we have 11 more coming up, so you'll see us lots all over ECTV, because we're going to do a 12-part series from the Lackawanna County Medical Society, and it's called Public Health Education Series, and it is funded in part by Commonwealth Health. And joining us today, who did a great job, I must say, is Dr. Ariane Conaboy, who is an she's an internist. She practices internal medicine at a private practice affiliated with Commonwealth Health. And then we have Mr. Kris Novak, who is the coordinator of student health services at the Wright Center. And I'd like to tell you that the next series will be, how about this, Avoiding Medical Emergencies. That's coming up on the next series, but you'll see them repeated because our good friend Mark, behind the camera, always makes sure from ECTV that these are played very nicely and enough time so that you can be educated, because that's what this is all about, to educate the public on simple ways that you can be take better care of your health and be so much more knowledgeable, and be your own self-advocate, which is very important, I think, from all standpoints. So thank you for watching. We'll see you in a little bit. Again, the next one is Avoiding Medical emergencies. Thank you again, Doctor. And Kris, thanks. Have a great week.
Thank you.
Thank
See you
you.
soon. I will see you real soon. I'm Laurie Cadden, and stay tuned for our next series.